Natural remedies for hormone balance. Turning to natural herbal remedies for hormone balance instead of hormone replacement therapy, HRT, can offer several pros and cons.
Here's a breakdown.
Pros of natural herbal remedies. Fewer side effects. Herbal remedies often have milder side effects compared to HRT, making them a gentler option for some individuals, including less dependency or habit forming than taking medication. Holistic approach. Many herbal remedies not only address hormonal balance, but also promote overall well-being, including stress reduction and improved mood. Natural ingredients. Herbal remedies are derived from plants and may appeal to those seeking natural treatments without synthetic hormones. Cultural and traditional use. Many herbal remedies have a long history of use in various cultures, providing a sense of tradition and trust. Accessibility. Herbal supplements can be more accessible and easier to obtain than prescription medications. Cons of natural herbal remedies. Variable effectiveness. The efficacy of herbal remedies can vary widely among individuals, and scientific evidence supporting their effectiveness may be limited. Lack of regulation. Herbal supplements are not as strictly regulated as pharmaceuticals, leading to potential quality control issues. Interactions with medications. Some herbs can interact with other medications, potentially leading to adverse effects or diminished effectiveness. Delayed results. Herbal remedies may take longer to show effects compared to HRT, which can provide more immediate relief for hormone-related symptoms. Individual differences. Not all herbs work for everyone, so finding the right remedy may require time and experimentation. Pros of HRT. Targeted treatment. HRT can provide quick and targeted relief from severe symptoms related to hormonal imbalances, particularly during menopause. Well studied. HRT has extensive clinical research backing its efficacy, but needs to be regularly monitored by medical healthcare providers. Customized dosage. HRT can be tailored to individual needs, allowing for precise hormone level adjustments. Cons of HRT. Potential side effects. HRT can have side effects, including weight gain, mood changes, and an increased risk of certain health conditions, e.g., blood clots and certain cancers, posing potential life-threatening illnesses. Long-term commitment. Some individuals may become dependent on hormone replacement therapy and need to remain on HRT long-term, which requires ongoing medical supervision.
Cost.
HRT can be more expensive than herbal remedies, particularly because it is commonly not covered by insurance. Hormonal dependence. Some people may worry about becoming reliant on synthetic hormones for hormonal balance. Choosing between natural herbal remedies and HRT depends on individual preferences, symptoms, and health conditions. It's essential to consult with a healthcare provider to weigh the pros and cons and determine the best approach for your specific needs. A combination of both approaches may also be beneficial for some individuals. Here are some natural herbal remedies that may help with hormone balance. 1. Maca root. Known for its adaptogenic properties, maca root can help regulate hormones and support overall hormonal health, particularly in women. 2. Vitex. Chaste tree berry. Often used to address menstrual irregularities and symptoms of PMS, Vitex can help balance estrogen and progesterone levels. 3. Ashwagandha. This adaptogen can help reduce stress and cortisol levels, promoting hormonal balance and overall well-being. 4. Red clover. Rich in phytoestrogens, red clover may help alleviate menopausal symptoms and support estrogen balance. 5. Holy basil. Known for its stress-reducing properties, holy basil can help regulate cortisol levels, contributing to hormonal stability. 6. Turnkey. Often used in traditional Chinese medicine, Turnkey may help balance estrogen levels and support menstrual health. 7. Flaxseed. High in omega-3 fatty acids and lignans, flaxseed can support hormone balance, particularly in managing estrogen levels. 8. Ginger. Ginger can support digestion and may help regulate menstrual cycles, contributing to overall hormonal health and offering anti-inflammatory properties. 9. Turmeric. With its anti-inflammatory properties, turmeric may help balance hormones by reducing inflammation in the body. 10. Licorice root. Licorice root may help support adrenal health and regulate cortisol levels, but it should be used cautiously and under supervision, as it can affect blood pressure. Important considerations. Consult a healthcare professional. Always consult with a healthcare provider before starting any herbal remedy, especially if you have existing health conditions or are taking medications. Quality matters. Choose high-quality herbal supplements from reputable sources to ensure safety and efficacy. Individual response. Herbal remedies can affect individuals differently, so it may take time to find the right approach for your specific needs. Incorporating these herbal remedies along with a balanced diet and healthy lifestyle can support hormone balance effectively. Herbal remedies for menopausal symptoms. The recommended doses for herbs used to treat menopause and support hormone balance can vary based on factors such as individual health, specific symptoms, and the form of the herb, e.g., capsules, tinctures, teas. Here are some general guidelines, but it's crucial to consult with a healthcare professional for personalized recommendations. Here are some natural herbal remedies that may help alleviate menopausal symptoms. 1. Black cohosh. Often used to reduce hot flashes and night sweats, black cohosh may help balance estrogen levels. Recommended dose: 40 to 80 milligrams of standardized extract per day, usually divided into 1 to 2 doses. 2. Red clover. Rich in phytoestrogens, red clover can help manage hot flashes and support overall hormonal balance. Recommended dose: 40 to 160 milligrams of standardized extract or 1 to 2 grams of dried herb per day. 3. Maca root. Known for its adaptogenic properties, maca root can help alleviate mood swings and improve energy levels. Recommended dose: 1.5 to 3 grams, about 1 to 3 teaspoons, of powdered root daily, taken in divided doses. 4. Turnkey. This traditional Chinese herb may help regulate menstrual cycles and balance hormones during menopause. Recommended dose: 500 to 1,000 milligrams of standardized extract or 1 to 2 grams of dried root daily. 5. Evening primrose oil. High in gamma-linolenic acid (GLA), evening primrose oil may help reduce breast tenderness and hot flashes. Recommended dose: 500 to 1,000 milligrams of oil, usually providing 50 to 100 milligrams of gamma-linolenic acid per day. 6. Ginseng. Ginseng may help improve mood, reduce fatigue, and enhance overall well-being during menopause. Recommended dose: 200 to 400 milligrams of standardized extract containing at least 4 to 7% ginsenosides per day. 7. Holy basil. Known for its stress-reducing properties, holy basil can help manage anxiety and support hormonal balance. Recommended dose: 300 to 600 milligrams of standardized extract or 2 to 3 grams of dried leaf daily. 8. Ashwagandha. This adaptogen may help reduce stress and anxiety, which can be particularly beneficial during menopause. Recommended dose: 300 to 600 milligrams of standardized extract with phenolides content per day. 9. Lemon balm. Known for its calming effects, lemon balm can help alleviate anxiety and improve sleep quality. Recommended dose: 300 to 600 milligrams of standardized extract or 1 to 3 grams of dried herb daily. 10. Turmeric. With its anti-inflammatory properties, turmeric may help reduce joint pain and inflammation associated with menopause. Recommended dose: 400 to 600 milligrams of standardized extract, curcumin, taken 2 to 3 times a day or 1 to 3 grams of powdered root daily. Important considerations. Always choose high-quality, standardized extracts when possible to ensure consistent dosing. Responses to herbs can vary, so it may take some time to find the right dose for your needs. Always consult a healthcare provider, especially if you are pregnant, nursing, have health conditions, or are taking medications. These guidelines are general. Personalized advice from a healthcare professional is crucial for safety and effectiveness. Always consult with a healthcare provider before starting any herbal remedy, especially if you have existing health conditions or are taking medications. Choose high-quality herbal supplements from reputable sources to ensure safety and efficacy. Herbs can affect individuals differently, so it may take time to find the right remedy for your specific needs. Incorporating these herbal remedies, along with a healthy lifestyle, can help manage menopausal symptoms effectively. To become certified in one of our holistic programs in as little as 4 to 6 weeks, explore or learn more at www.holisticschool.online. Thank you for joining us.